of Ayurveda. So that's why whenever you are taking advice from anyone in Ayurveda, just like you can see my degrees beneath my name, similarly, always make sure that the consultant, that the doctor with whom you are consulting is authenticated, has studied properly, because Ayurveda is one of the best science which our ancients has gifted us with. But if Ayurveda is taken wrongly, even if it is not going to cause harm, but since parents, patients, and all of you nowadays believe on Ayurveda and you are believing and you are approaching Ayurveda for various critical ailments, if not given properly, it can rob the person of that valuable time which every disease gives to a person. So it's very important that if you are taking Ayurveda, it should be with the right kind of people. Now, coming to Ayurveda, before we go to the regular questions which we take for autism, it's time to be discussing certain things about hepatitis today. With World Hepatitis Day soon approaching, it becomes important to realize what exactly is hepatitis and what is the difference between being hepatitis positive and having hepatitis. I have always said in various videos of mine, and by the grace of Almighty, some of those videos are the most watched videos across YouTube and other platforms, that once a virus called hepatitis virus, it can be of various varieties. It can be A, it can be B, it can be C, it can be D. It can be various kind of hepatitis virus which may gain access in the body. Whenever a hepatitis virus goes inside the body, our immune system tries its level best that it can neutralize that virus. It can ensure that the virus doesn't divide inside our body. We have been gifted by a great immune system by nature. But if the virus is able to get across that immune system at the first level, it's only then that the acute phase of hepatitis virus in the body may change into chronic phase. And once that first step goes away, the virus will now remain inside your bodies and it may remain silent for years and years together. It may not cause any signs, any symptoms in you, and even throughout life. A person may be having virus inside the body and still may not be having any signs of hepatitis. So it becomes very important. There are multiple videos which have been shared by me on this channel of mine, because today it's time to be discussing autism with all of you. But wherever you feel that someone is really worrying from hepatitis, you can share the link with him or her, because many parents, many patients, they start taking antivirals without any reason. They don't even need that. The virus is so inactive inside their body, yet they are taking those antivirals. So coming back to the basic topic which we are to discuss today, autism. So we are talking about autism today. And when we say autism, and when I, all thanks to Almighty, and all thanks to Ayurveda, all thanks to psychotherapy, when I confidently tell my parents who approach for their young kids, for their middle-aged kids, that autism is a temporary phase in the life of a child. When I say that, I know that we can do that. Because it's very important, first of all, to accept. I come across many parents who keep on waiting for NHS to tag their child as being autistic, for other government health providers in Canada, in US, to tag their child as being autistic, and it's only when the child is completely tagged as being autistic that they prefer starting with something. Always remember, if you see that your child is having a less eye contact, if you see that your child is having speech issues, if you see that your child is hyperactive, if you see that your child is not responding properly to name, do not keep on waiting. We don't need our children to be tagged as being autistic, ADHD, GDD or something before starting anything for them. No, that should not be the case. If we feel that a child is different from other children, even in some aspects, don't wait. Don't let a child be tagged. Maybe if the problems are less, you don't need any medications for your child. It's only guidance that can work. And if the problems are more, yes, definitely, then there are herbs which definitely help. Mudassar Ali ji, Mutullah ji, a very warm welcome to both of you. Yes, you are sharing the details with me, and I definitely will be going ahead with any query which is there in your mind, and it's always lovely to be having you all over there in our live sessions. So what I was just discussing was that the first thing is ensuring that if the child needs help, we need to be acknowledging that. It should not be a case where we keep on waiting for someone to tag our child. And now the worst part is that for many years the parents will keep on waiting for the child to be tagged as being autistic, as being ADHD child, as being GDD child. And one fine day, when eventually the child gets tagged with these diseases, the people start visiting the web, discussing those things with psychiatrists, with pediatricians, neurologists. None of them is a specialist in autism. And at times with the therapists, OT therapist around you, a speech therapist around you, a behavior therapist around you. Now all of a sudden the parents will start approaching them. And once they approach those people, unluckily, allopathy believes that autism is something which should be accepted and managed. Even in psychotherapy, with so many psychotherapists now claim that yes, they can work wonders for your child. But even if you ask one of them that have they been able to bring a child completely out of autism independently, the answer is a big no. Neurologists, psychiatrists, pediatricians, none of them has the solution. And that is why the solution lies in combining Ayurveda with psychotherapy. And that also, it should not be a mere guesswork where any odd doctor starts, takes a chance with your child, and any psychologist is trying out various things on your child. No, it is the entire life of your children. We need not try things over there. Anything which has to be done for your child must have been thoroughly researched, must have been proven, must have given an autism-free future to multiple kids, and only then it can be working for your child. And that is why when we here at ND Care US, ND Care Canada, ND Care Nirogam Private Limited, Wrist Push, these are various brands, Nirogam Australia, these are various organizations working in various parts of the globe, Nirogam Ghana. So whenever in these organizations we are taking up any child's case, we ensure that the future of your child is really very precious. That is why whenever we are picking up any child suffering from any kind of heuristic concern, developmental concern, concentration span concern, we ensure that first of all the behavior is thoroughly analyzed. That is why those small videos which my team asks you to be consistently sharing is really very important for us. For all of you who are joining us late, I would like to tell you that I am currently in UK, and I'll be in US, Canada soon, and I will be doing my live sessions for all of you during my visits over here. And my team there in India, our doctors, our psychologists, and whenever I am there in India, we are always there for your support. We ensure that we are guiding you with the best of things. So the first bold step towards your child's autism-free life is ensuring, understanding that yes, whatever we are guiding, even if you need to probe that up, even if you need to be checking it out, it becomes very important for us to understand. Am I audible to to everyone, team? And I feel, team, you will have to take a small and a very little break, because as I can see, our battery is going to die soon. So I need to be doing something about that. So be there with us. It will be a small break, a very small break, which we shall be taking. They may not be having suitable videos for putting up over there. So it will just be a, yeah, we have it. So any one video for you. Breno A will be the good one, Jovan. It will be Breno A one, which will be playing for them. And by the time you are through with that video, I will be right back with you guys. You have it, Jovan, with you? Yes. So let me help you out over there. Yes. Yeah.
Hello friends, greetings. I am the Great Kali. If you also want to stay fit like me, then you should try Wrist Pushed, and my trust has been strengthened by Dr. Navdeep Sharma. Just as I have defeated wrestlers and made India's name ring out across the world, in the same way, Dr. Navdeep Sharma's Wrist Pushed Ayurveda.
I can't remember anything. I wish I could help her with the exam.
Yeah, you can welcome them back,
My
Jovan.
grandmother used to mix special herbs and almonds.
She made us drink it every day.
And believe me, we remembered everything.
Best of
Yeah.
luck, Beta.
Thank you.
Again back with you guys. And so I was talking about the importance of the right kind of diagnosis, and once the right kind of diagnosis have been made, after that ensuring that we try to understand what are the strongholds of a child and what are the shortcomings of a child. Unluckily, when the parents have tried a lot many things before coming to us, even when they approach us, yes, it is understandable that they are having multiple doubts in their mind. It's understandable that they may not be immediately believing on what we are saying, because all of a sudden when the world is saying it cannot be done and someone immediately tells you it can be done, I can understand it's tough to believe at that time. But what we are to understand over there is that if we really want our child to come out of this condition called autism, it's important that we do believe that yes, the child can make the way out of it, because till the time we ourselves are underconfident, we are not going to help our child come out of it. Once you have your questions, we are always welcome. If you're having any questions in your mind, that you should be asking everything up, because that's why we encourage Google Meets, we encourage the compilation of cases, because we also want that if any question is there in the mind of any parent, that question should never remain unanswered, because it's only when the queries are answered that yes, after that the parents, they can believe, and then they can be proceeding with what we are guiding. And with all thanks to God the Almighty, the parents who are there with us, who show faith on us, we use certain herbs and we know which herbs we are using. When we say herbs, there are various herbs that we use in our medications, like Jatamansi is one of them, Vacha is one of them, Shankpushpi is one of them, Ashwagandha is one of them, Lavender is one of them. There are multiple herbs that we use in our medications for the parents to give to their children. And the best part is that we use these herbs in their purest extract based forms, and these are in the form of dry syrups. Why we use them in extract form is that we really want that the taste of those medications should be very good, palatable for the kids, and at the same time, not just the taste, but at the same time the kids should get results also, because when we are giving herbal extract based supplements, the small dosage of herb is able to give the exact quantity of herb that is guided in those ancient Ayurvedic texts. Unluckily, in majority of the syrups which are available in the market for Ayurveda, it's more of sugar and so less of herbs. That is why they show more of placebo kind of effects. But when we prepared all those things, we already kept in mind that the problems which are already there in the available medications, in the available combinations over there, we need to rectify those problems, because it's only then that if a proper dosage of medication is going inside a child, that the sensory concerns which the children are facing, those sensory concerns can then only calm down. And to ensure that autistic child speaks, to ensure that autistic child is not hyperactive, it's really very important that at the first juncture itself, the sensory concerns of your child are managed, they are not missed. So over here, I would once again like to acknowledge your question, Muhammad Asir ji. शिष्टा की मेडिसिन सर ब्रह्मी वटी वचादी घृत मनस्परा चिंतामणि रस चल रही है विद पंचकर्मा कंडीशन सर इम्प्रूव नहीं हो रही. मैं चाहूँगा जी शिष्टा की आप डिटेल्स मुझे ज़रूर शेयर करें क्या क्या चल रही हैं, और एक बार आपने पेशेंट आईडी शेयर किया है, जो आपके कोऑर्डिनेटर हैं उनके साथ भी आप डिटेल ज़रूर शेयर करें. करेंटली क्योंकि मैं थोड़ा ऑन इंटरनेशनल टूर हूँ, सो माई टीम ऑन माई बिहाफ विल डेफिनेटली बी गेटिंग बैक टू यू. और मैं थोड़ा ये भी चाहूँगा कि जो चीज़ें आपको लग रही हैं कि आप दे रहे हैं, कितने दिन से दे रहे हैं, क्या समय हो गया है, मुझे प्लीज़ बताएं. और मोहम्मद जी मतुल्ला जी, आपने बताया माई डॉटर जोयास्मीन इज 14 years. Regular cucurbita iron Brelo plus syrup, ABA sessions regular, and therapy just started. How many days? Proper response. Generally, at the age of 14 years, sir, it will take around 3 to 4 months for you to be watching small changes. Because the age is more, it will take a longer time for you to see results. But once you do that patiently, you definitely are going to see the results. So it was just a small live today in order to say a hi to you at the starting of this tour. So that's why I went live with all of you, and it's always great to be connecting, and I will try going live as often as possible and connecting with you. If there are any questions you're there in mind which you are unable to ask me when I am in India and in other time zones which do not suit you, especially in UK, you're always welcome to ask your questions. So thanks a lot for joining us today. Have a good day.